Today we're doing a head-to-toe assessment with Marissa Butler. Marissa, this is an assessment, a physical assessment from head to toe. It should take no longer than 30 minutes. If there's any point that you're uncomfortable or experience pain, please let me know, okay?
Okay.
First off, starting with your eyes, we're going to look at the external structure of your eyes. Your eyes are symmetrical in good proportion with the rest of the features of your face. There's no protrusion or sunkenness in appearance in your eyes. Can you close your eyes and open them? You can leave them open. Eyelids close completely over the eyes. The lid margins seem appropriate. Color is appropriate. Eyelashes are evenly distributed. Lacrimal glands, I'm going to pull down a little bit, are pink and moist, no redness or discharge noted. I'm going to palpate around your eyes for a second. Any tenderness or any pain?
Nope.
No swelling or tenderness noted around the eyes. I'm sorry, let me pull down a second. Conjunctiva is pink and moist. Sclera is china white. As far as pupils are round, equal in size and shape. We're going to test your pupils to light. I have a pen light for that. Pupils react quickly to light bilaterally. Next, we're going to test your accommodation. You look at a point on the wall, and then you're going to look at my pen. I will tell you when. You look at my pen. Now look at the wall. Then look at my pen again. Pupils constrict appropriately to accommodation. Next, we're going to test corneal light reflex. If you want to just look straight at me, I'm going to have a light flashing in both eyes. In both pupils, the reflection is at 3 o'clock equally. That's good. Next, we're going to test your cardinal field. If you can just follow my pen. Good. Next, I'm going to check your nose. Nose is straight at the midline. There are no lesions or redness noted. There looks to be no flaring noted. If I was to look into Marissa's nostril, no redness or drainage noted. And the septum is intact at the midline. Same on the right side. No redness, no discharge. Septum is intact at the midline. Good. Next, we're going to check your ears. The external right ear, there are no lesions or redness noted to that ear. Looking inside the ear, no redness or drainage noted. Tympanic membrane is pearly gray. Good. Also no nodules. The left ear, no redness or drainage noted, no nodules, no lesions, and tympanic membrane is great. I'd like to test your hearing now, if I could. I'm going to stand behind you. I'm going to whisper, and I want you to repeat after me.
1, 2, 3. ABC.
Good. I'm going to snap. I want you to raise whatever hand to the side that you hear it. Good. Next, I'm going to check and palpate and auscultate your temporal arteries bilaterally. Normal pulsation on the left. Doesn't hurt, right?
Nope.
No tenderness or firmness. Normal pulsation on the right. No tenderness, no firmness. Next, I'm going to auscultate using the bell of my stethoscope. On the left side, no bruits. On the right side, no bruits. Next, I'm going to test your sternomastoid. So I'm going to place my fingers behind your sternomastoid joint. I'm going to ask you to open and close your mouth. side to side. Good. I feel free movement, very smooth, no clicking and no crepitus. Good. Alright. Next, I'm going to check your mouth. With that, I'll use a pen light and tongue depressor. First, you stick out your tongue. Oral mucosa is pink and moist. No lesions, no erythema, no masses inside. As far as her gums, you lift up your tongue. No bleeding, normal color, no discoloration, pink and moist. All teeth appear to be intact, white with good alignment. Next, I'm going to ask you to open your mouth and say ah. Uvula is at the midline, rising appropriately, along with the soft palate. Soft palate and hard palate are pink and moist. Tongue, no deviations, move it left to right. Good. Good. No lesions, no redness noted either, which is good. All right. Next, I'm going to check your carotid arteries. First, I'm going to palpate. Easily palpable on the left side. +2. Easily palpable on the right. They're palpable bilaterally with a regular rhythm. +2. Next, I'm going to auscultate your carotid arteries. The bell of my stethoscope. If you could take a deep breath, hold it. No bruise on the left side. No bruise on the right side. Good. Next, we're going to check your cervical nodes, both posterior and anterior. The pad of my fingers. I'm just going to look for nodes starting in the back of your neck, and your trapezius, on your clavicle, up your posterior sternocleidomastoid, underneath your ears, chin, anterior sternocleidomastoid. So no nodes have been palpable, no tenderness. Okay. Next, I'm going to look at your trachea. Palpate your trachea. Trachea appears to be at center at the midline. No masses or deviations noted. Next, we're going to look at your thyroid gland. To do that, we're going to take a couple sips of water. First, I am going to feel for your isthmus, which is below your cranial cartilage. If you want to go ahead and put some water in your mouth, I'll tell you when to swallow. Go ahead. Isthmus swallows and raises, and then rests and lowers in the resting position. Next, I'm going to be palpating your thyroid from the anterior view. So I'm going to have you turn to your left. I'm going to put my fingers inside your sternocleidomastoid muscle. Try to palpate your thyroid. I'm going to ask you to take a drink. I don't feel any lobes or nodules. Is there any tenderness?
Nope.
Okay. We're going to do the other side. Same thing. We're going to take some water. I feel no nodules. I don't feel any now. They're not palpable. And there's no tenderness, correct?
Correct.
Next, I'm going to ask you to stand. We're going to look at your posterior neck, or posterior back. I'm going to fix the camera. Can I have you... There we go. Alright, first off, looking at your back, if you have no shirt, I'd be able to inspect your skin, look for lesions, bulges, or masses. I'd also be able to see skin color being appropriate to you. Can you give me a couple breaths? Chest seems to rise symmetrically upon inhalation. Doesn't appear to be a lag with a regular rhythm. Next, I'm actually going to percuss for posterior thorax, starting at the top. Now, up to now, I've heard tympanic sounds. As I move towards her diaphragmatic excursion, we will have dullness. Like right there. And going back into the lateral, we'll go back to tympani. Right. Next, I'm going to auscultate her posterior thorax, starting at the top. And breathe in and out. Like when you percuss, you want to remember that the scapulars are here, so you percuss and you auscultate around those areas so you get a clear and appropriate sound. Her lungs are clear throughout. There's no crackles or wheezing noted. I'm going to have you turn around. We're going to inspect the interior thorax. Can you give me a couple breaths? Okay, another. And you can just breathe normally. Looks like breathing is normal rhythm. Chest rises symmetrically. No accessory muscles seem to be in use. Skin is warm and dry. No lesions, no bruising, no bulges, no masses. So it looks good. Next, I'm going to auscultate her thorax, interior thorax, for the different lung sounds, starting in the bronchial, where these are high-pitched sounds, over her trachea. Whereas, as I move toward her bronchioles, you'll have bronchiovesicular sounds. These are lower-pitched sounds. You notice I'm doing it bilaterally on both sides. We'll also listen for her vesicular sounds. So in her outer lung fields. Her lungs again are clear throughout bilaterally. No crackles, no wheezing. Good. Next we're going to listen to heart sounds, starting with the aortic valve, which is the second intercostal space on the right. We move to the pulmonic valve, which is the left intercostal space. Moving to the Erb's point, which would be the third left intercostal space. Then moving to the tricuspid valve, which is the fourth at the left intercostal space at the left sternal border. And then finally, the mitral valve, which is the fifth intercostal space at the left mid-ventricular line. I hear no extra heart sounds and no murmurs. Next, I'm going to listen for apical pulse. By this, you will go down to the fifth intercostal space, which would be around here at the left mid-ventricular line. Right here, I can hear apical pulse. You would normally count over 60 seconds. I will do an abbreviated assessment as it stands on her pulse rate is 60. Good. Next, I'm going to have you lay down on the couch and we're going to look at your abdomen. First, I'm going to inspect your abdomen. It does look smooth. If her shirt was not on, then we'd be able to inspect it in for color, look for any lesions, masses, or bulges. We could also use the pen light, and it would give us a better idea of any indurations or abnormalities of the abdomen. Abdomen also looks symmetrical. Again, if her shirt was off, we might be able to we would be able to see her umbilicus, hopefully at midline. We'd also might be able to see pulsations in her epigastric region and or peristalsis in her lower abdomen. But again, on inspection, abdomen looks good. Next, I'm going to auscultate for vowel sounds, starting in the right lower quadrant. She does have active vowel sounds. At this point, we could also use the Butler microscope or stethoscope and look, assess for bruits, and there are no bruits noted. Next, I would like to percuss your abdomen, starting in your right lower quadrant. Okay. All quadrants are tympanic aside from when you get to the liver, where there's a dullness. To see the liver, you could actually percuss up to the lower border of the liver and percuss down. And again, you're going from tympany to dullness. Most livers are between 6 and 12 centimeters long. So next we're going to palpate. It's a shallow palpation, looking for masses or any tenderness the patient might be experiencing. Doesn't appear like that. A little deeper palpation. The liver, spleen, and kidneys aren't palpable at this point. And again, there's no masses or tenderness noted. At this point, we could also palpate for the inguinal nodes. They are freely movable, a little bit difficult to palpate. They're the upper thigh, just below the inguinal ligament. Okay. While you're down, I'd like to assess your femoral pulses. Again, we're going to assess pulses bilaterally. First the right. Her right femoral pulse is a 2+. And versus left also 2+. So her pulses are equal bilaterally. Okay. Can you stand please for me? Alright. I'm going to make sure the camera is set up. Next, we're going to assess your upper extremities. First, if you look, skin is warm and dry. There are no lesions, no redness, no masses, no bulges. I'd like you to put your arms out like this, checking your brachial pulses. Brachial pulses are palpable bilateral at a 2 plus. Next, I'm going to check your capillary refill. You just hold out your hands like this. Alright, capillary refill is less than 3 seconds, which is good. Next, we're going to test your grasp. So if you could hold my 2 fingers and squeeze. This has good strength bilaterally. Good. Next, we're going to test the Allen test, where I'm going to need you to hold out your hand like this. With 3 fingers on both my hands, I'm going to include the radial and ulnar arteries, and I'd like you to go like this 10 times. Okay. Letting go of the radial artery, blood circulation returns within 5 seconds, which is good. We're going to try it with the other hand, again including the ulnar and radial arteries. Squeeze. Alright, this time letting go of the ulnar artery, and again circulation looks good to the right hand. Alright, good. Next, I'm going to have you sit, and I'm going to assess your popliteal, posttibial, and dorsalis pedal pulses. First, your popliteal pulse on your right, on your left. And those are equal bilaterally, +2. Next, we're going to check your posttibial on your right and on your left. Again, those are equal +2 as well. Next, your dorsalis pedal pulse. Both are palpable bilaterally at a 2 plus. Good. While we're down here, I'm going to check for edema. Mr. does not have pitting edema on either extremity. Good. Can you stand up again? Looking at her lower extremities. Everything looks symmetrical. Skin looks normal to the person. I don't see any lesions or masses or nodules. Skin is dry and warm. Good. Next, I'd like you to lay down. We're going to check for home implant. I'm going to put you dorsiflex your foot and hold your calf and squeeze it. Do you have any pain? No? There is no warmth, no swelling on the right. Doing the same. Dorsiflex your foot, squeezing your calf. Any pain? And again, no swelling or pain on this calf. This is a medical emergency if she was positive for that test. So if you like, we could stand up. Next, we're going to do the Romberg test. If you want to stand straight, arms at your side, look straight ahead and close your eyes. We're going to do this for 30 seconds. I'm going to check if you sway. This is a test for cerebellar and vestibular function. All right, good. One note, when I was percussing your back, I had used the term tympany. It was actually your lung fields were resonating, and then over the lung fields, not tympany. Tympany would be for your abdomen. At this point, our assessment is over. Thank you. Any questions?
No.
All right, thanks.